30 UK-based doctors, nurses and medical professionals have written a powerful open letter to Prime Minister Keir Starmer and Foreign Secretary David Lammy. In the letter, they call for an immediate and total ban on arms sales to Israel and a range of urgent medical and humanitarian interventions. Dear Prime Minister, we are 30 qualified doctors, surgeons, nurses and medical professionals based in the UK who have volunteered in Gaza since October 7th, 2023. We worked with various non-governmental organisations and the World Health Organization in hospitals throughout Gaza. In addition to our medical and surgical expertise, many of us hold current roles within the NHS, as well as having worked in humanitarian crises and conflict zones across the world. Many of us also have long-standing experience working with British charities in Gaza and across the Occupied Palestinian Territory, OPT. We've seen the deliberate targeting of civilians on a mass scale and a total lack of resources due to the destruction of Gaza's healthcare system and deliberate restriction of aid. The deleterious effects of Israeli occupation on the Palestinian healthcare system are something many of us have seen before, but never to this extent. We are a multi-faith and multi-ethnic group, united not by any political motivation, but by the desire to care for those who are suffering. The Constitution of the World Health Organization states, quote, "The health of all peoples is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. It is in this spirit that we write to you, and it is in this spirit that we realize that we cannot remain silent about what we saw in Gaza. We are among the only neutral observers who have been permitted to enter the Gaza Strip since 7th of October. With international journalists being targeted and denied access to Gaza, our eyewitness experiences have had to serve in place of journalistic or investigatory accounts. Given our broad expertise and unique first-hand experience of working in Gaza in recent months, specifically, we believe we are well positioned to comment on the massive human toll from Israel's attack on Gaza, on Palestinian men, women and children, as well as the long-term and systematic destruction of the healthcare system, which will impact the sick as well as the wounded for years to come. This letter collects and summarises our own experiences and direct observations in Gaza. We are willing to speak to government officials in more detail about the specifics of our experiences in parliamentary, evidentiary or other forums as required. It is impossible to know the true death toll in Gaza. The Ministry of Health figure of approximately 40,000 Palestinians killed refers only to the number of identified bodies. But while working in Gaza, we bore witness to untold numbers of unidentified bodies, many of them truly unidentifiable due to the extent of damage caused. A correspondence piece in The Lancet, one of Britain's leading medical journals, estimated that the true figure could be 186,000, reflecting the scale of indirect and unrecorded deaths that have inevitably occurred due to the destruction of the healthcare system. Those suffering from malnutrition due to Israel's use of starvation as a weapon of war, and those suffering from waterborne diseases from Israel's restriction of water and aid has increased the Gaza population suffering further. We demand that the UK government acts immediately to bring an end to the continued Israeli military escalation of catastrophe in Gaza. The United Kingdom must ensure that its policies are ones that result in a ceasefire by withholding military support to Israel and ending arms trade with Israel. We believe our government is obligated to do this, both under British law and international humanitarian law, IHL, and that it is the morally as well as legally right thing to do. With only marginal exceptions, everyone in Gaza is sick, injured, or both. This includes every national aid worker, every international volunteer, and every man, woman, and child. While working in Gaza, we saw widespread malnutrition in our patients and our Palestinian healthcare colleagues. Many of us lost weight rapidly in Gaza despite having privileged access to food and having taken our own supplementary nutrient-dense food with us. We have photographic evidence of life-threatening malnutrition in our patients, from babies to the elderly, that we are willing or have already shared with you. Virtually every child under the age of 5 whom we encountered, both inside and outside of the hospital, had both a cough and watery diarrhea. Jaundice and hepatitis A infection were widespread in the hospitals in which we worked, while the surgical complication rate was near 100%. Surgical incisions were almost certain to become infected due to the hospital's impossible operating conditions, including a lack of supplies, water, and medications, including antibiotics, overcrowding, and due to patients' malnutrition. We were forced to use household supplies including vinegar for antiseptic purposes or went without. Due to the lack of painkillers, antibiotics, and hospital beds, patients exhibited a high rate of pressure necrosis. Pregnant women gave birth in unsanitary and overcrowded conditions, as there is simply nowhere left which is not unsanitary and overcrowded. These women face serious risk of complications, ill health, and death. Those of us who worked with pregnant women regularly saw stillbirths and maternal deaths that would be easily preventable in any functioning healthcare system. The rate of infection in C-section incisions was astonishing, and these were often delivered to women going without anesthesia or painkillers. Their infants were born underweight, while mothers are likely to be unable to breastfeed due to malnutrition. Potable water is unavailable across Gaza. Very few babies born under these conditions are likely to survive, and those who do will have their health permanently impaired. We urge you to realise that epidemics are raging in Gaza. In addition to that, Israel has not stopped bombarding civilians in their tents or displacing the malnourished and sick population of Gaza, approximately half of whom are children, to areas with no running water or even toilets available. This is a horrifying reality. It is virtually guaranteed to result in widespread death from viral and bacterial diarrheal diseases and pneumonias, particularly in children under the age of 5. According to the World Health Organization, since 19th of July 2024, poliovirus has now been discovered in wastewater samples in Gaza. We worry that unknown thousands have already died from the lethal combination of malnutrition and disease, and that tens of thousands more will die in the coming months. Most of them will be young children. Many of those who survive contracting polio will face lifelong consequences. We condemn the use of infectious agents and the destruction of healthcare infrastructure as a means of warfare to be responsible for far more deaths of civilians compared to all combat arms combined. All of us treated children who seem to have been deliberately targeted by military violence. Bullet wounds to children's heads and torsos and amputations of limbs and eyes of children were commonplace. Facilities serving Gaza's children have been destroyed, including the Al-Rantizi Children's Hospital and the Gaza European Hospital's Pediatric Intensive Care Unit. Much of the equipment for both facilities has been damaged during evacuation, and both are currently inoperative. The destruction of Gaza's healthcare system capacity has meant that patients with chronic medical conditions such as diabetes or renal failure are forced to occupy increasingly scarce hospital beds. While they are unable to access medicines and equipment, such as insulin, necessary for treating their conditions, it has been reported that these items, such as insulin needles, are being rejected at border crossings under, quote, dual-use prohibitions. Basic and specialist medication, including immunotherapy and specialist blood products, are wholly unavailable. The sole cancer specialist hospital in Gaza, the Turkish-Palestinian Friendship Hospital, has been rendered inoperative, turned into a temporary Israeli military base, leaving cancer patients without basic facilities and unable to access treatment. Israel has destroyed more than half of Gaza's healthcare resources and has killed 1 out of every 40 healthcare workers in Gaza. At the same time, healthcare needs have increased massively from the lethal combination of military violence, malnutrition, and disease. The hospitals where we worked were starved of basic supplies from surgical material to soap. They were regularly cut off from electricity and internet access, denied clean water, and operated at 4 to 7 times their bed capacity. Every hospital was overwhelmed beyond the breaking point by displaced persons seeking safety, by the constant stream of patients whose treatment of chronic conditions had been interrupted by the war, by the huge influx of seriously wounded patients who typically arrived in mass casualty events, and by the sick and malnourished seeking medical care. Prime Minister Starmer, Foreign Secretary Lamy, it is difficult for many of us to recount the scenes we witnessed in Gaza, not least of all in the knowledge that many of the injuries we treated may have resulted from the use of weapon systems and components supplied from Britain. This includes the victims of daily airstrikes conducted using F-16 and F-35 aircraft, part produced in the UK. Being some of the few UK citizens and residents able to travel to Gaza since October, we write to you in certainty that if you had seen, heard, and experienced the things we have, there would be no question of placing an arms embargo on Israel. As noted, it is impossible to truly gauge a death toll, but these observations lead us to believe that it is far beyond the 40,000 confirmed and identified dead by Gaza's health ministry. Tens of thousands face catastrophic injury of a type only inflicted by deliberate targeting of, or willful neglect for civilian life. What we have outlined to you amounts to probative evidence of widespread violations of British laws, international humanitarian law, and the UK government's own rules on arms exports, namely the Strategic Export Licensing Criteria. As we met our healthcare colleagues in Gaza, it was clear that they were malnourished and both physically and mentally devastated. We quickly learned that our Palestinian healthcare colleagues were among the most traumatized people in Gaza, and perhaps in the entire world. Like virtually all people in Gaza, they had lost family members and their homes. Most lived in and around their hospitals with their surviving families in unimaginable conditions. Although they continued working a grueling schedule, they had not been paid since October 7th. All were acutely aware that their work as healthcare providers had marked them as targets for Israel. This makes a mockery of the protected status hospitals and healthcare providers are granted under the oldest and most widely accepted provisions of international humanitarian law. Amidst raids, bombings, and destruction of Gaza's hospitals, many of our Palestinian healthcare colleagues were kidnapped by Israeli forces. During their detention, which lasted for weeks or months, almost all reported experience of physical and psychological abuse, mistreatment including torture, and sexual abuse, including being stripped naked, and other cruel and inhumane punishments. Punishments given them solely for their being doctors. When returning to the United Kingdom, meanwhile, some of us have faced harassment, including threats of murder and violence, from which we have not been protected by the NHS nor police. Some of us have also been the direct victims of Israeli airstrikes. While sleeping in a deconflicted safe house, some of us were targeted by Israeli artillery. A GBU-32, Mark 83, bomb landed 6 meters from the wall of our accommodation. This resulted in significant damage to the house as well as injuries to the medical team. We urge you to see that Israel has directly targeted and deliberately devastated Gaza's entire healthcare system, and that Israel has targeted our colleagues in Gaza for death, disappearance, and torture. These unconscionable acts are entirely at odds with British law, British values, and international humanitarian law. Prime Minister Starmer and Foreign Secretary Lammy, with your respective extensive legal backgrounds, you must acknowledge the widespread breaches of British and international law that continue to be committed in this conflict. Many of us have met and shared these stories with your colleagues in the Labour Party, but yet, we have seen no concrete action to prevent the senseless deaths occurring day in and day out. The UK government is impeding international procedures and has gone against its own standards that it has applied in other crises around the world. We sincerely hope to see these standards replicated in Gaza without hypocrisy to stop what is being done to innocent Palestinian men, women, and children. 1. Any solution to this problem requires the withholding of military, economic, and diplomatic support from Israel and participating in a full arms embargo of Israel until a permanent ceasefire is established and until good faith negotiations between Israel and the Palestinians lead to a permanent resolution of the conflict. In the meantime, 2. All land crossings between Gaza and Israel, as well as the Rafah crossing, must be opened to unfettered aid delivery by recognised international humanitarian organisations with a redeveloped, quote, security screening regime conducted by an international coordination regime independent of Israeli military forces. These screenings must be based on a clear, unambiguous and published list of forbidden items and with a clear, independent international mechanism for challenging forbidden items, as verified by the UN Office for the Coordination of Humanitarian Affairs in the Occupied Palestinian Territories. This is vital in mitigating potential famine arising as a result of Israel's use of starvation as a weapon of war. 3. Full and unrestricted access to the Gaza Strip must be created for medical and surgical professionals, including those of Palestinian descent who are currently barred by Israel from entering or working in Gaza. These healthcare professionals must have unimpeded ability to transport medical and surgical equipment in their personal luggage so that they may safeguard their proper storage, sterility, and timely delivery, as verified by the World Health Organization. 4. The delivery of community care, including immunization programs, must be ensured to help prevent communicable diseases including measles, polio, COVID-19, and skin disease. The United Kingdom must support the construction of field hospitals to service Gaza's population in place of now destroyed health facilities, and must look to funding and supporting the reconstruction of Gaza's hospitals in the future. 5. A bare minimum water allocation of 20 litres of potable water per person per day must be allocated to the population of Gaza, as verified by UN Water. This is vital in mitigating the spread of waterborne diseases. 6. Respect and support for international and domestic accountability mechanisms from the UK government must be ensured. This includes supporting the International Criminal Court prosecutor's investigation in the Palestine situation, South Africa's case before the International Court of Justice, domestic universal jurisdiction prosecutions, and any other means of judicial, political, and diplomatic accountability. We repeat, we are not politicians driven by political agendas. We are simply medical professionals who feel duty-bound to speak out about what we saw in Gaza. Our duty is to our patients, to our fellow healthcare workers still in Gaza, and to humanity. It is the same principle of duty many of us apply to our day-to-day work in the NHS as we did in Gaza as well. Every day that the United Kingdom continues supplying weapons and munitions to Israel is another day that the Palestinian men, women and children of Gaza are killed and maimed by weapons, including those manufactured in the UK. Prime Minister Starmer and Foreign Secretary Lamy, we urge and implore you to end our role in this unimaginable cruelty now. Signed by Dr. Mohammed Junaid Sultan, Victoria Rose, James Smith, Alan Frederick Graham Groom, Dr. Andrew Ferguson, Basil Boudère, Dr. Omar El Taji, Miss Anna Gilani, Mahim E. Qureshi, Miss Kaji Sritharan, Konstantina Ilya Karidi, Professor Nick Maynard, Mohammed Abdulsami, Dr. Deborah Harrington, Miss Sarah Phillips, Tim Goodacre, Dr. Moira Leng, Mohammed Farouk, Dr. Alicia Mariam Karimi, Dr. Ahmed Habib, Dr. Ibrahim Barouni, Dr. Riyad Mashaka, Dr. Khalid Dawas, Dr. Abdullah Hanoun, Amer Shawab, Dr. Shah M. Rahman, Dr. Asma Lina Fazlani, Professor Ghassan Abu Sita, Professor Suhail A. Khan, and that was the letter by 30 UK-based doctors, nurses and medical professionals written to Prime Minister Keir Starmer and Foreign Secretary David Lammy, calling for an end to the UK's role in the assault on Gaza.